What is Otulfi? Otulfi ustekinumab-aauz is an injectable prescription medicine which is a biosimilar to Stelara that may be used to treat Crohn's disease, ulcerative colitis, moderate to severe plaque psoriasis, and active psoriatic arthritis, which are all autoimmune conditions. Otulfi's mechanism of action involves blocking certain inflammatory proteins in your body, called IL-12 interleukin-12 and IL-23 interleukin-23. These proteins are known as cytokines, and they are responsible for the inflammation associated with certain autoimmune conditions. By blocking their activity, Otulfi reduces inflammation, pain, swelling, and skin symptoms. Otulfi gained FDA approval on September 27, 2024, as a biosimilar to Stelara. A biosimilar is a biological product that is like the reference biologic, in this case Stelara, and for which there are no clinically meaningful differences in terms of safety, purity, and potency. Otulfi is expected to be available in February 2025. Otulfi is used to treat moderate to severe plaque psoriasis in adults and children aged 6 years and older who are candidates for phototherapy or systemic therapy, active psoriatic arthritis active in adults, and children aged 6 years and older, Crohn's disease moderately to severely active in adults 18 years and older, ulcerative colitis moderately to severely active in adults 18 years and older. Otulfi side effects. The most common Otulfi side effects are nasal congestion, sore throat, and runny nose, redness at the injection site, upper respiratory infections, vaginal yeast infections, fever, urinary tract infections, headache, sinus infection, tiredness, bronchitis, itching, diarrhea, nausea and vomiting, stomach pain. Before taking this medicine, you should not use Otulfi if you are allergic to the active ingredient ustekinumab, Otulfi, Stelara, or any of the inactive ingredients contained in Otulfi have received a BCG Bacillus calmette and Guerin vaccine within 1 year before, during, or 1 year following treatment, have active tuberculosis. Before you start treatment with this injection, your doctor may perform tests to make sure you do not have tuberculosis. Tell your doctor if you have ever had tuberculosis, if anyone in your household has tuberculosis, or if you have recently traveled to an area where tuberculosis is common, to make sure Otulfi is safe for you. Tell your healthcare provider about all your medical conditions, including if you have signs of infection, fever, chills, cough, muscle aches, painful skin sores, diarrhea, pain when you urinate, feeling very tired or being treated for an infection, or have any open cuts, get a lot of infections, or have infections that keep coming back, have new or changing skin lesions within psoriasis areas, or on normal skin have a latex allergy as the needle cover on the pre-filled syringe contains latex. Receive or have received phototherapy, light therapy for psoriasis, are receiving or have received allergy shots, especially for serious allergic reactions. Allergy shots may not work as well for you during treatment with Otulfi. Otulfi may also increase your risk of having an allergic reaction to an allergy shot recently received or are scheduled to receive any vaccine. People who take this medicine should not receive live vaccines. Tell your doctor if anyone in your house needs a live vaccine. The viruses used in some types of live vaccines can spread to people with a weakened immune system and can cause serious problems, are pregnant or plan to become pregnant, or breastfeeding. Some people using this medicine have developed skin cancer, non-melanoma. However, these people may have had a higher risk of skin cancer. Talk to your doctor about this risk and what skin symptoms to watch for. You may need to have regular skin exams. How is Otulfi administered? Follow all directions on your prescription label and read all medication guides or instruction sheets. Use the medicine exactly as directed. Otulfi is intended for use under the guidance and supervision of your doctor. Prepare your injection only when you are ready to give it. Do not use it if the medicine looks cloudy, has changed colors, or has particles in it. Call your pharmacist for new medicine. Crohn's disease and ulcerative colitis. The first dose of Otulfi is given through a vein in the arm, intravenous infusion by your healthcare provider. It takes at least 1 hour to receive the infusion. Your next doses will be given as an injection under the skin, subcutaneous injection every 8 weeks. Psoriasis or psoriatic arthritis, Otulfi is given as an injection under the skin, subcutaneous injection as described below. How to administer subcutaneous Otulfi in children 6 years and older. Otulfi should be administered by a healthcare provider. If your doctor decides that you or a caregiver may give your injections at home, you should receive training on the right way to prepare and inject Otulfi. Your doctor will determine the right dose for you, the amount for each injection, and how often you should receive it. Your dose needs may change if you gain or lose weight. Do not try to inject yourself unless you or your caregiver have been shown how to use it by your doctor or nurse. Inject Otulfi under the skin in your upper arms, buttocks, upper legs, thighs, or stomach area, abdomen. Do not give an injection in an area of the skin that is tender, bruised, red, or hard. Use a different injection site each time you use this medicine. Use a needle and syringe only once and then place them in a puncture-proof sharps container. Follow state or local laws about how to dispose of this container. Keep it out of the reach of children and pets. Throw away any unused portion of Otulfi. Be sure to keep all of your scheduled follow-up appointments. Otulfi dosing information. The dosage of Otulfi is dependent on the patient's weight. Your healthcare provider will calculate this for you. Adults less than or equal to 100 kilograms, Otulfi 45 milligrams. Adults more than 100 kilograms, Otulfi 90 milligrams. Crohn's disease and ulcerative colitis, Otulfi is given as an infusion for the first dose, then as a subcutaneous injection every 8 weeks thereafter. Psoriasis and psoriatic arthritis, Otulfi is given as a subcutaneous injection initially, and 4 weeks later, then a dose is given every 12 weeks. Otulfi is available as subcutaneous injection. Otulfi 90 mg ml single dose pre-filled syringe. Otulfi 45 mg 0.5 ml single dose pre-filled syringe. Intravenous infusion. Otulfi single dose vial 130 mg 26 ml 5 mg ml.